Or are you doing this to make money, or both?
Both.
Take this email sent to the Verify team. Is it safe to have your house cleaned by outside workers? The best practice is to limit guests to emergencies only.
We know things are changing every day, but we're here with you. Continuous COVID-19 coverage during prime time. We're committed to giving you facts, not fear. On 11 Alive News Primetime, weeknights from 8 to 11 on WATF.
There are everyday actions to help prevent the spread of respiratory diseases. Wash your hands. Avoid close contact with people who are sick. Avoid touching your eyes, nose, and mouth. Stay home when you are sick. Cover your cough or sneeze. Clean and disinfect frequently touched objects with household cleaning spray. For more information, visit cdc.gov/COVID-19. This message brought to you by the National Association of Broadcasters and this station.
Today at noon on 11 Alive.
We are seeing that lack of smell or altered taste can be a symptom.
We answer your coronavirus-related medical questions. Because 11 Alive is where Atlanta speaks.
Televised newscasts not enough for you? Get even more at 11 Alive's YouTube channel, where you'll find uncut interviews, extended body cam footage, live streams of Atlanta's biggest trials, and more. Subscribe to 11 Alive today.
In times of great uncertainty, some things become more clear. The things we take for granted, the people we depend on daily. Here at 11 Alive, we'd like to say thank you. First responders, medical staff, sanitation workers, truck drivers, postal workers, and every brave Georgian doing their part to make a difference. We see you, we hear you, and we appreciate all that you do.
Let's start with a viral message going around. Quote, vast majority of people who died had ibuprofen Advil in their system. This message is fake.
We just bought 20 dust masks for $97. Are you doing this to help people, or are you doing this to make money, or both?
Both.
Take this email sent to the Verify team. Is it safe to have your house cleaned by outside workers? The best practice is to limit guests to emergencies only.
We know things are changing every day, but we're here with you. Continuous COVID-19 coverage during prime time. We're committed to giving you facts, not fear. On 11 Alive News Primetime, weeknights from 8 to 11 on WATF.
There are everyday actions to help prevent the spread of respiratory diseases. Wash your hands. Avoid close contact with people who are sick. Avoid touching your eyes, nose, and mouth. Stay home when you are sick. Cover your cough or sneeze. Clean and disinfect frequently touched objects with household cleaning spray. For more information, visit cdc.gov/COVID-19. This message brought to you by the National Association of Broadcasters and this station.
Today at noon on 11 Alive.
We are seeing that lack of smell or altered taste can be a symptom.
We answer your coronavirus-related medical questions. Because 11 Alive is where Atlanta speaks.
Televised newscasts not enough for you? Get even more at 11 Alive's YouTube channel, where you'll find uncut interviews, extended body cam footage, live streams of Atlanta's biggest trials, and more. Subscribe to 11 Alive today.
Let's start with a viral message going around. Quote, vast majority of people who died had ibuprofen Advil in their system. This message is fake.
We just bought 20 dust masks for $97. Are you doing this to help people or are you doing this to make money or both?
Both. Take this email sent to the Verify team. Is it safe to have your house cleaned by outside workers? The best practice is to limit guests to emergencies only.
Right now at noon, reopening another round of Georgia businesses. We're getting your reaction as restaurants get the green light to resume dine-in service. One of Georgia's biggest industries. When is it time to reopen film studios? The specific plan Tyler Perry is considering to eventually get back to work. And a second chance for small business help. What local owners need to do today to hopefully get some of that relief.
Live from the 11 Alive studios, our special coronavirus coverage, Facts Not Fear, starts now.
Good afternoon. I am Christy Diaz. Thanks for joining us for Facts Not Fear at noon. Georgia continues to move forward with its plan to get the state back up and running. Today, movie theaters and private social clubs can open their doors and restaurants can finally reopen their dining rooms. The industry among the hardest hit during all of this. Among those allowing diners back inside, Waffle House. Nick Sturdivant is in Atlanta with the big changes the iconic chain has put in place.
We're here at the Waffle House on Piedmont Road near Sidney Marcus, and the grills are fired up. And for the first time in about a month, they're allowing people to eat inside. But it's not the Waffle House that you're accustomed to, open 24/7. Right now, the Waffle House is under restrictions aligned with the state of Georgia.
We were here this morning as the first customers ate inside. However, throughout the morning, we noticed a majority of people opted to do takeout. To eat inside, booths and tables have to be moved in order to follow social distancing guidelines. Waffle House's CEO says customers will also have to wait outside before being seated, and staff will have to operate with a skeleton crew. Governor Brian Kemp laid out guidelines for restaurants wishing to reopen. They include screening employees for signs of illness, requiring staff to wear face masks at all times, and limiting capacity to no more than 10 customers per 500 square feet. Salad bars and buffets will be discontinued.
Now, there's been a lot of reaction online to Georgia's reopening, and 11 Alive is where Atlanta speaks. So Liza Lucas breaks down what you have to say.
There are mixed feelings when it comes to Georgia restaurants reopening. Similar to the social conversation we saw with gyms and salons, that divide is playing out online. And we want to hear from you. What do you think of it all? And will you go to businesses as they open their doors? Our poll is live, 11alive.com/vote, ready for you to weigh in. So far, we've heard from many of you who tell us you're staying home for now. Jeremy has a full refrigerator and is staying put. And others echoed that it's too soon, tweeting with the hashtag stay home. Margaret questioning how social distancing will impact restaurants that do choose to reopen. But Jeff offers a different perspective. He says he'll be among those going back to work, adding his restaurant already has many reservations. Where do you stand? 11 Alive is where Atlanta speaks. So will you be going to these businesses as they start to reopen? Or what changes do you want to see before you feel comfortable? Our poll again is live, 11alive.com/vote, where you can share your perspective.
Just as restaurants have the option to reopen today, so do private social clubs. We spoke to Ryan Wilson, the co-owner and founder of The Gathering Spot, a well-known private club here in Atlanta. He tells us why that club will remain closed.
The goal for us is always to maintain the safety and security of our membership community. And so everything that we've seen from a data perspective doesn't suggest that it's the right time to open yet. And so we're not going to do so until there's better testing available, but also better guidelines about the best way to protect the community that we serve every day.
The Gathering Spot has 3,000 members and is known to host an array of events and bring in big-name celebrities and politicians. Wilson tells us as of right now, it appears the club will be closed all of next month. Meanwhile, Atlanta rapper 2 Chainz now going back on his original announcement to open his restaurant Escobar beginning today. Less than 24 hours after his business partner and co-owner Snoop Dillard told TMZ they were going to reopen. Now they're saying it's a no-go. They say they're still deciding when they will have dine-in service. One of Georgia's biggest filmmakers is weighing a plan to reopen too. Tyler Perry is reportedly detailing a possible plan to get back to business at his South Atlanta studio. The actor, producer, and entrepreneur saying the 330-acre facility can only reopen provided he can implement coronavirus testing for cast and crew members. Perry must also allow them to live on site when they shoot their productions. TMZ reports he'll begin by reopening 6 shows he's currently working on. TMZ also reports Perry plans to provide a doctor and a nurse for a hospital building that's also on the site and could be turned into a functional clinic. Tyler Perry has said he wants to work directly with Atlanta Mayor Keisha Lance Bottoms on this plan to move forward in the correct way. The mayor spoke on the subject on the Tamron Hall Show.
I've not discussed this in detail with Tyler, but I think it's a very different situation if you know that you have a set of people who have not tested positive and they are living in a contained area. But that's something I would want to get input from our health experts on. We know we're going to have to phase in this economic recovery.
Mayor Bottoms has been a vocal critic of Governor Kemp's order urging Atlanta citizens to continue social distancing despite businesses being allowed to reopen. A day of prayer this morning. Governor Brian Kemp joined faith leaders in a prayer service at the state capitol. Because of social distancing, the ceremony was not open to the public, but the governor's office did live stream it on Facebook. According to the State Department of Public Health, there are now 942 deaths, 23,773 confirmed cases, and 4,433 people hospitalized. Here in Georgia, testing is ramping up with help from Walmart. Governor Kemp announcing the state is launching more drive-through testing sites in rural communities. Beginning today, a mobile unit will travel between Augusta, Milledgeville, and Tifton on a rotating basis. There are now 48 testing sites across the state. This is video from a testing site in Dawson County over the weekend. Happening today, small businesses will get a second chance at getting a loan through the Paycheck Protection Program. The program will take new applications today as part of an additional $322 billion in federal emergency aid signed into law by the president last week. The original fund was quickly drained by high demand, leaving many mom-and-pop style owners empty-handed. Experts say to apply through an eligible lender like a trusted bank. After already transferring stimulus money to the bank accounts of nearly 90 million Americans, the IRS says it has mailed the first batch of paper checks. The federal agency sending out some of those checks last Friday. The IRS plans to send up to 5 million paper checks a week and has created a schedule for mailing those payments. For more information on how to check the status of your payment, go to 11alive.com. Coming up, 11 Alive medical correspondent Dr. Sujatha Reddy is answering your coronavirus questions. Let us know if you have a specific question by texting us at 404-885-7600. And remember, text that number, don't call.
Let's start with a viral message going around. Quote, vast majority of people who died had ibuprofen Advil in their system. This message is fake.
We just bought 20 dust masks for $97. Are you doing this to help people or are you doing this to make money or both?
Both. Take this email sent to the Verify team. Is it safe to have your house cleaned by outside workers? The best practice is to limit guests to emergencies only.
We know things are changing every day, but we're here with you. Continuous COVID-19 coverage during prime time. We're committed to giving you facts, not fear. On 11 Alive News Primetime, weeknights from 8 to 11 on WATF.
There are everyday actions to help prevent the spread of respiratory diseases. Wash your hands. Avoid close contact with people who are sick. Avoid touching your eyes, nose, and mouth. Stay home when you are sick. Cover your cough or sneeze. Clean and disinfect frequently touched objects with household cleaning spray. For more information, visit cdc.gov/COVID-19. This message brought to you by the National Association of Broadcasters and this station.
Today at noon on 11 Alive.
We are seeing that lack of smell or altered taste can be a symptom.
We answer your coronavirus-related medical questions. Because 11 Alive is where Atlanta speaks.
Televised newscasts not enough for you? Get even more at 11 Alive's YouTube channel, where you'll find uncut interviews, extended body cam footage, live streams of Atlanta's biggest trials, and more. Subscribe to 11 Alive today.
NBC is reporting an uptick in calls to poison control centers for exposure to disinfectants and hand sanitizer. This comes as bogus home remedies for coronavirus continue to be discussed on social media. Now, this uptick comes after the president's suggestion during a press briefing last week about injecting disinfectants as treatments. After he was pressed on it, he said he was being sarcastic. The manufacturer of Lysol has since issued a statement warning people not to ingest or inject their products. Now, we know you have a lot of questions about the information you're hearing and seeing. 11 Alive medical correspondent Dr. Sujatha Reddy is here helping give you the facts, not fear, about COVID-19. So let us know if you have a question by texting us to the number on your screen. That's 404-885-7600. All right, let's welcome in Dr. Reddy now. Thanks for being here. Let's jump right in. All right, Caitlin texted us. She wants to know this. What can healthcare workers who aren't comfortable with the continued risk of exposure, what can they do now that elective surgeries can resume, and what are their family members supposed to do?
Yeah, and this is a good question. And, as a surgeon, believe me, it's come to my mind too. I know there are specific protocols being put into place. We think intubation, when you put the breathing tube down the patient's throat, that's probably one of the riskiest times. So there's things where we're having everyone leave the room during that time, special precautions. But if you're just not comfortable, I think it's reasonable to talk to your hospital or surgical center and find out what they're doing to keep you safe and what are your options. Perhaps you can do something not in the operating room for a short time until you feel more comfortable.
Okay, Dr. Reddy, Sydney wants to know this. Can you get the virus in your eyes by simply walking past someone who has sneezed or coughed?
I thought that was actually a really good question. Thanks for asking it, Sydney. When I went through a lot of the data that's out there, no one is recommending protective eyewear except for healthcare providers, because obviously you have a prolonged exposure. I think that's part of it. The longer you're exposed to the virus, the higher the risk. We've been told the virus lives on surfaces, maybe in the air for a short time, but these are not documented ways the virus is transmitted. So, long answer short, I think it's okay to walk around without goggles. I think if you're taking care of someone who's actively sick with COVID-19 or in a hospital situation, I think eye protection is better. If you're the least bit worried, you can get some sort of clear goggles, or if you wear glasses, wear those. But virus going into your eyes, I don't believe through the air is a way that's going to put you at great risk.
All right, but if long exposure, better safe than sorry. Got it. Okay, so William asked this. If someone is on Humira and steroids for arthritis, does this increase the risk for lung complications from the virus?
Good question. I think anything like steroids that suppresses your immune system, if you're on whole body steroids, it could. The best thing to do is talk to the doctor prescribing the steroids and ask them if they feel you should take extra precautions. Another easy way is if they've told you in the past to be extra careful about the flu, then you're at higher risk for the coronavirus as well, or the complications as well.
Okay, good rule of thumb. Becky shared this. She said, I caught a bug my coworker had at the end of February before they started testing for COVID-19. He was told it was just bronchitis, but I had the symptoms of coronavirus. Should I look into the antibody test?
Yeah, good question. I think the answer here is it depends. We don't have a lot of information about the antibodies, how long they're going to protect you. But if you test positive, it could mean you were exposed. But I guess my question would be, what's that information going to do for you? If it helps you to know that, yes, you had it in the past, the antibody test will help you. The problem is right now, even if someone has antibodies, because this is so new, we don't know how protective, if at all, that's going to be. We think it's going to be protective in the short run, but we just don't know.
Right. They're still doing a lot of tests and learning a lot about those antibody tests, too. So the next question from Wendy. What are your thoughts about a person getting a knee injection? I read that steroids could put me at risk for the virus.
So if it's just a one-time right in your knee local injection, I don't think that's going to put you at high of a risk of someone getting whole body steroids. So if it's a one-time injection, you probably are okay.
Okay, Becky has an interesting question. I think a lot of people are in this situation. She said most of the people I work with are in the same situation as me. We have cheap phones, live paycheck to paycheck, and we don't have internet access. So how can we get tested or make a doctor's appointment if we get sick, since everything is online now? I'm a high-risk person, but all appointments have been canceled because I can't video chat.
Well, we're doing some visits in our office just by phone, and that may be an option for her. You know, that's a really tough one. You know, with privacy concerns, I don't think you'd want to go to like a public place and use their internet. I understand that. But a lot can be done just on the phone. If you don't have the ability to do a video, you may be able to get some care through the phone, but that's a really tough one. But again, I'm just going to, you know, I've tried to be the voice of hope here for a long time, but I do feel like in the next month or 2 or 3 months, we're going to get some better idea as to how to treat this virus. I think we'll get some medication ideas, like what's effective, and I think that's going to really help us get back to seeing patients in the office. We're starting to do that, but obviously if you're high risk, it's best not to.
Dr. Reddy, we could all use a dose of hope. All right, so the next question is from Amber. She says, Georgia is opening bars, salons, and other businesses where it's hard to practice social distancing. Do you recommend visiting businesses like these? I feel like it's too soon.
Yeah, and I think you have to make this decision for yourself. I would agree. I don't think I'd be rushing out to, you know, get a haircut just yet. Maybe in the next few weeks. I think it also depends on the person you are. If you're at higher risk, I absolutely would not go. If you're a younger, healthy person and you're going crazy at home, then maybe it is time to get out there and slowly do things. But I think that's going to be an individual decision. There's definitely no harm in waiting, although we do want to support our local businesses. But I think we're going to get a better idea how to do this over time. So I think that's a personal decision.
Of course, curbside pickup, things like that can definitely make those things safer. All right, Dr. Reddy, thank you so much. Don't go anywhere. Just ahead, Dr. Reddy will answer more of your coronavirus questions. Keep sending them in by texting us to this number, 404-885-7600. And remember, don't call that number, just text it, and please do include your name. Now, as we head to break, how about a little music to brighten your day?
Let's hear it for the ladies who launched. Everybody rise! Rise! Rise!
Cheers to a star-studded social media moment. Meryl Streep, Audra McDonald, and Christine Baranski donned bathrobes and grabbed their drinks to belt out a Stephen Sondheim song, Ladies Who Lunch, for the composer's 90th birthday celebration. Sondheim actually turned 90 back on March 22nd, but plans to celebrate were taken online after Broadway shut down because of the coronavirus pandemic. Luckily, this trio, they really embodied quarantine vibes for the many online watching from home. Be honest, you've done that, haven't you? It's 12:17 right now. We'll be right back.
YouTube channel where you'll find uncut interviews, extended body cam footage, live streams of Atlanta's biggest trials, and more. Subscribe to 11 Alive today.
In times of great uncertainty, some things become more clear. The things we take for granted, the people we depend on daily. Here at 11 Alive, we'd like to say thank you. First responders, medical staff, sanitation workers, truck drivers, postal workers, and every brave Georgian doing their part to make a difference. We see you, we hear you, and we appreciate all that you do.
Let's start with a viral message going around. Quote, vast majority of people who died had ibuprofen Advil in their system. This message is fake.
We just bought 20 dust masks for $97. Are you doing this to help people or are you doing this to make money or both?
Both. Take this email sent to the Verify team. Is it
Welcome back. Medical correspondent Dr. Sujatha Reddy is here to answer more of your coronavirus questions. Dr. Reddy, let's get started. TJ asked, my 91-year-old grandmother tested positive for coronavirus and is still not showing symptoms. I realize that up to 14 days is the general guideline, but is there a chance that the test was flawed?
So the tests are usually pretty accurate if they're positive because you're looking for a piece of virus. It's possible that your 91-year-old grandma just isn't having symptoms or having very mild ones. But I would at this point believe the test if it's positive.
Okay, and most cases do seem to be mild, at least the percentages seem to be that way.
And that's something we have to take to heart. 80+% are going to be mild, not going to the hospital symptoms.
Okay, good news for his grandmother. All right, Liz wants to know, if someone has malaria antibodies, are you less likely to contract the coronavirus?
Yeah, I don't think we can say that. Again, it's a new virus. We just don't have the information, but we think everybody is at risk.
Okay, next question, Janice asking us, we are grandparents. We are missing our grandkids desperately. Is there any new timeline on when they can come over safely? Man, so many families feeling this right now.
Yeah, and I think as we start to ease the restrictions, that's going to be one of the first things we're going to do. And it's probably one of the safer things to do because if everyone's been home, the odds of the transmission is going to be low. So I think that's coming soon. Thank goodness we have the technology to at least see each other. But yeah, I do think that's coming soon. And I think that's going to be, again, on a case-by-case basis. If you're an older person with underlying health conditions, you may want to just take it a little slower than if you're an older person without those conditions.
Right. Okay. Dee asked us this question. So when is it safe for the medically fragile to leave home for work or to look for work, etc.? Would it be best to wait until there's a vaccine?
Ideally, yes, but that's not going to be practical because we're hoping we'll have a vaccine, but it's not going to be, I think, till early next year at the earliest. So I think, medically fragile people with those underlying conditions, those are the people that need to really go slow and only do what's essential. Try to limit your trips, continue to do what we're doing for as long as possible. So right now, I think if you're in a high risk group, I would still be very careful. And we're going to have better information the longer we wait, but I don't have an exact time. But the longer you hold off, the safer for you.
All right, Lice texted us this question and said, I've heard that very few people with type O blood have serious COVID-19 complications. Could this be true?
Yeah, there's no concrete scientific data about blood type. There have been several, internet stories going around that blood type, certain ones are better, and there's just no scientific data to back that up. Everyone is at risk regardless of your blood type at this point.
Still a lot to learn about this virus. Another viewer asked us this, can the virus be, or what is the difference between bacterial pneumonia and COVID-19?
Yeah, so bacterial pneumonia is what we typically see, a pneumonia that you see commonly after someone has gotten a cold or something where a bacteria is causing the actual infection. The COVID-19 pneumonia is a specific kind of lung problem caused by this new coronavirus. And what's different is the coronavirus seems to affect the entire lung. Often with pneumonia, you get one lobe or part of the lung that's infected. But the bottom line is a bacterial pneumonia is caused by a bacteria. The COVID-19 pneumonia is caused by this new coronavirus, and in a way, it's a lot more serious and scary than traditional pneumonia.
Okay, Brian has a question about the safety of his family. I wonder if many couples are facing this. He says, I work at a grocery store and my wife works from home and does not really leave the house. She is worried about me bringing home the virus, so she keeps me at arm's length, even after I sanitize and wash my hands. What can we do to make both of us more comfortable?
Yeah, that's a hard one. I have my parents that live with me and they're older. When I go to the office, I have that same fear. What am I bringing home? And I take all the precautions I can. And that's all we can do. At this point, I think I would, take your wife's concerns seriously. And unfortunately, I think she's got to do what makes her feel comfortable, and it's keeping you a little bit at bay for now. I think that's the right thing to do. It sounds like you're doing all the right things. short of changing your job, I don't think there's a lot we can tell you to do differently. But again, I think over time, as we learn more and, get more testing out there and perhaps hopefully get a medication that's going to be effective, she may let you closer in. But for now, I think that is the best thing to do if that makes her feel better about it.
All right, Dr. Reddy, thank you for your insight. These viewers bringing us excellent questions. You're doing a great job answering them. We will be right back.
People who died had ibuprofen Advil in their system. This message is fake.
We just bought 20 dust masks for $97. Are you doing this to help people or are you doing this to make money or both?
Both. Take this email sent to the Verify team. Is it safe to have your house cleaned by outside workers? The best practice is to limit guests to emergencies only.
We know things are changing every day, but we're here with you. Continuous COVID-19 coverage during prime time. We're committed to giving you facts, not fear. On 11 Alive News Primetime, weeknights from 8 to 11 on WATF.
There are everyday actions to help prevent the spread of respiratory diseases. Wash your hands. Avoid close contact with people who are sick. Avoid touching your eyes, nose, and mouth. Stay home when you are sick. Cover your cough or sneeze. Clean and disinfect frequently touched objects with household cleaning spray. For more information, visit cdc.gov/COVID-19. This message brought to you by the National Association of Broadcasters and this station.
Today at noon on 11 Alive.
We are seeing that lack of smell or altered taste can be a symptom.
We answer your coronavirus-related medical questions. Because 11 Alive is where Atlanta speaks.
Televised newscasts not enough for you? Get even more at 11 Alive's YouTube channel, where you'll find uncut interviews, extended body cam footage, live streams of Atlanta's biggest trials, and more. Subscribe to 11 Alive today.
In times of great uncertainty, some things become more clear.
We first told you last Sunday about an Ackworth church that paid off more than $1 million of deferred medical debt for families across Metro Atlanta. Now we're hearing from one of those families. Mara Sirianni spoke with a Bartow County couple suffering the financial burden after a miscarriage. The donation from the church wiping away that painful debt.
Brooke and Curtis Shields have a beautiful, healthy family. They've also experienced the unexpected heartbreak of losing a child.
We have 4 in total, but one that we never actually got to meet.
In 2014, Brooke suffered a miscarriage. Every month for the past 6 years, the bill has served as a painful reminder.
That bill specifically was the hardest bill that I've ever received. We accumulated several bills during that time, because we had to spend a lot of time in the hospital to hopefully prevent the miscarriage from happening.
But on April 23rd, something remarkable happened. The Shields received a letter in the mail letting them know their debt had been wiped away by the members of Freedom Church.
I expected when I saw something coming from a medical type letterhead on it, I was thinking, oh, here we go, here's another bill that we got to pay that I forgot about. And it turns out it was just the opposite.
Freedom Church teaming up with RIP Medical Debt to take care of outstanding bills for 1,043 families.
We really just wanted to dive into the needs of the community.
Brooke posting about the donation on social media.
The post I made was really just talking about the intimacy of God and how He works in our lives, and just saying thank you, that we were so appreciative and grateful and surprised.
For the Shields, the pain will never go away, but the remainder of the bill is something they'll never have to think about again.
We appreciate everybody that had a part in making this happen. It's been a blessing for our family.
What a great story. We always got to leave you on a high note with a little hope. And before we go, make sure you've got the 11 Alive app. That's where you'll find all the important information and coronavirus updates. Thanks for watching Facts Not Fear at noon. Stay safe.
Channel, where you'll find uncut interviews, extended body cam footage, live streams of Atlanta's biggest trials, and more. Subscribe to 11 Alive today.
In times of great uncertainty, some things become more clear. The things we take for granted, the people we depend on daily. Here at 11 Alive, we'd like to say thank you. First responders, medical staff, sanitation workers, truck drivers, postal workers, and every brave Georgian doing their part to make a difference. We see you, we hear you, and we appreciate all that you do.
Let's start with a viral message going around. Quote, vast majority of people who died had ibuprofen Advil in their system. This message is fake.
We just bought 20 dust masks for $97. Are you doing this to help people or are you doing this to make money or both?
Both. Take this email sent to the Verify team. Is it safe to have your house cleaned by outside workers? The best practice is to limit guests to emergencies only.
We know things are changing every day, but we're here with you. Continuous COVID-19 coverage during prime time. We're committed to giving you facts, not fear. On 11 Alive News Primetime, weeknights from 8 to 11 on WATF.
There are everyday actions to help prevent the spread of respiratory diseases. Wash your hands. Avoid close contact with people who are sick. Avoid touching your eyes, nose, and mouth. Stay home when you are sick. Cover your cough or sneeze. Clean and disinfect frequently touched objects with household cleaning spray. For more information, visit cdc.gov/COVID-19. This message brought to you by the National Association of Broadcasters and this station.
Today at noon on 11 Alive.
We are seeing that lack of smell or altered taste can be a symptom.
We answer your coronavirus-related medical questions. Because 11 Alive is where Atlanta speaks.
Televised newscasts not enough for you? Get even more at 11 Alive's YouTube channel, where you'll find uncut interviews, extended body cam footage, live streams of Atlanta's biggest trials, and more. Subscribe to 11 Alive today.